esteemed speakers, distinguished participants, ladies and gentlemen. I thought I'll just depart a little bit from script. I want to sort of talk about vintage. We're all in the same vintage. I'm also of the same vintage. But then I want to offer you and I want to suggest to you a different perspective in terms of thinking about vintage. I think what Ben is referring to and what is confirmed by Jennifer is that all of us have the mindsets, the vitality of a 28-year-old with the dreams, the passion, and the ambition of an 18-year-old. So don't look at this shell. Just think about the infinite possibility. So we're all in that same vintage. You know, Temasek is always a very special place. And each time, whenever I get a call, regardless of how short a turnaround time that my ex-colleagues at Temasek have given me, I would always try and tell my colleagues in MTI or MOM, let's try and see how we can assist. So first, a very humble apology. I would have loved to stay on for the entire conversation. Unfortunately, I have to rush off for a meeting after this. And one key example is how Temasek has always stayed ahead of the curve in terms of innovation, out-of-the-box thinking, and yet maintain that same rustic charm. Very much like this ball, this is actually a very innovative device to reduce the viral load in the air. Yet, it looks like a sepak takraw ball. So if you can see, no, I'm not selling koyok, so early, and I'm very mindful of the fact that this is being recorded in eternity. But just something to think about. And I hope that it is this spirit of new and old, and that vintage vitality versus what we actually see visually, I think is something that we have to be able to connect. So I think with that, I go back to my script. So a very good morning to all of you. It's indeed a privilege and an honor to be amongst experts. And both of them I know very well. John is 1 year my senior, by the way. Daniel is many, many years my junior. So he's very young. So, they are experts in health transformation, and as well as they are change makers today. And really, to be able to discuss challenges in youth mental health, what kind of opportunities for engagement and innovation to tackle some of these challenges collectively. Now, I wouldn't say it's been a long time since I was a youth. Actually, it seemed like yesterday when I met them in medical school. So not that long, including Alex. Now, I think that these unprecedented times have actually precipitated and also coincided with a global surge in mental health challenges for our youths. The National Youth Council's data from last year showed that over 40% of youths who did not struggle before the pandemic reported that their mental well-being had worsened. And this is actually quite a disturbing trend. 20% of the youths also reported poor or very poor well-being in 2021. A University of Calgary study published in 2021 found that depressive and anxiety symptoms have doubled in children and adolescents globally when compared to pre-pandemic estimates. Now, the task force analyzed Singapore's mental health landscape, and developed recommendations to strengthen the mental health ecosystem for all citizens, including youth, in a number of ways. Developing a national mental health and well-being strategy, building a one-stop online portal for national mental health resources, and also creating a national mental health competency training framework. Now, there were multiple agencies. Many of them actually have stepped up to task. There was a national care hotline launched in April 2020 by MSF, the Ministry of Social and Family Development, to support those facing mental health concerns relating to COVID-19. And even there, even then, there's a national task force formed to look into dealing with this and coordinate it across various ministries and across many sectoral agencies. And I guess it's serendipity. Yesterday we had a meeting on, I think it was Task Force number 3. This is organized and spearheaded by MOH, but Manpower has also stepped in to see how we can actually work with employers, provide them with resourcing, provide them with more significant hand-holding resource. Because a lot of employers, even though they want to help in managing mental well-being at the workplace, even in recruiting and hiring and placing employees with past history of mental issues, not necessarily the extreme ones, but with a history of, I wouldn't call them even disorders, but some form of mental help that's needed. What kind of resourcing is available to them? I think it's going to be very, very important moving forward. And it's something that the Manpower Ministry is also looking into significantly and trying to commit more resources into it. It's because we want to ensure that the workplace, particularly for not just our youth, everyone is young, but to think about how to make it a safe, a very welcoming environment to be in so that they can give their best without worry, without the fear of an apprehension of harassment, of being stigmatized, or being ostracized. I think it is important. And from our studies, from anecdotal sharing by many, many employers, including myself in my past life as a corporate person, one key thing about most employers in not being able to come forward and help even more, even though many of them would want to, is really the apprehension and the fear of the unknown. Because they don't know, first, they don't know what they don't know. And the other thing is that should there be a crisis triggered, either as a result of some workplace or even on the internet itself, where do they get the resource to help them to deal with it? So I think that if it is something that collectively all of us can think about, including getting government agencies involved in this, I think it will go a long way. So perhaps sometime towards the conversations today, all of the experts here could think about this thing and provide ideas for us in the Manpower Ministry itself. We'll be quite happy to adopt a very nuanced approach forward. So our institutes of higher learning, they have also strengthened their mental health programs. Our polytechnics, our ITEs have worked with Health Promotion Board on a mental wellness literacy curriculum for all first-year students to raise awareness and understanding of mental health, as well as encourage and foster early help-seeking behavior. Peer support structures have also been rolled out in every school where students look out for one another and alert a trusted adult if there are concerns. All employers, whether they are here today or they join us online, and we will continue to put out the message, and we hope that through you, our ambassadors, you can also continue to encourage all employers to consider signing up for iWork Health, which is an online workplace psychosocial health assessment tool to find out the employee's overall state of mental well-being and the stress factors at work. The company report can provide a breakdown of the mental well-being scores by each age group. And this will really be an enabling force to help both employers and younger workers, many of whom are online and also here, to better understand the state of your mental well-being, including devising a targeted approach to address the specific work stresses faced. So I'm really glad that the Temasek Foundation has made very concerted efforts to partner with community organizations and healthcare experts on mental health programs that raise the awareness, build capability, and raise mental health literacy. And platforms like these, Temasek Shophouse Conversations, is especially helpful to bring leaders and policymakers together to collaborate and to take action on youth mental health. Now, lastly, at the community level, I'm heartened to see that about 1,500 individuals, comprising youths, parents, caregivers, and mental health professionals, have started more than 20 ground-up projects under the Youth Mental Wellbeing Network, or YMWBN. The government will press on. We will give our fullest support to strengthen and grow the YMWBN. Besides support from the various organizations and initiatives, each and every individual in the community can play a big part. We can start by showing empathy in our day-to-day interactions with others, such as by understanding the issues faced by our youths, that they are real, and that we will listen to their needs and we will give support to them. I'm hopeful that today, together with the healthcare experts from KK Women and Children's Hospital and a community mobilizer like Campus PSY, today's conversation will bring about multi-sectoral collaboration to take action and to do good together. I thank the organizers again for this wonderful initiative, and I wish all of you a very productive, fruitful, most importantly, relaxing conversation ahead. Thank you very much.